I'm looking at you. Okay.
Go ahead.
Okay, hi, my name is Alexa Steckler. I'm a fourth-year medical student from the Warren Alpert Medical School of Brown University, and I'm excited to be presenting at ASCO 2025 this year. My research is focusing on oncofertility and the family-building options that patients have in order to create a family after they undergo their cancer treatment. For background, ASCO 2025 guidelines emphasize the need for timely, comprehensive fertility counseling at the time of diagnosis and prior to initiating gonadotoxic anti-cancer treatments, including chemotherapy, radiation, surgery. A variety of other international societies, including the American Society for Reproductive Medicine, also emphasize this counseling early on. Interestingly, this counseling is not always done, and there's a variety of iterations of this nationwide. Egg and embryo cryopreservation are one method for preserving fertility, but there are other methods that include gestational surrogacy, adoption, egg and embryo donation that deserve recognition and attention before treatment. A gestational surrogate, for the purposes of our study, is someone who carries a pregnancy using the intended parent's embryo or donor embryo with the intention of delivery and then giving the child back to the intended parents, in this case, the cancer patient. For this study, I developed a survey that asked about patients' awareness of different fertility options, the counseling they received at the time of diagnosis, and their attitudes towards a variety of family-building options, including gestational surrogacy. I distributed the survey nationwide through several amazing nonprofit cancer care organizations. We reached over 500 participants, so women who were diagnosed with cancer during their reproductive years. And the findings were very interesting. So of over 500 women, 80% said that they did recall a conversation with their medical provider, their oncologist, at the time of diagnosis about how their fertility or ability to conceive would be impacted by cancer treatment, though 58% of those women said that they were aware of gestational surrogacy at the time of their diagnosis. When we asked where they learned about it, the overwhelming majority cited non-clinical resources, so the internet, social media, as the major source of their information about gestational surrogacy, which is fantastic, but there's certainly room for improvement in terms of getting that information from accurate, evidence-based sources, such as an oncologist, a reproductive endocrinologist, infertility specialist. We also found that 27% of participants specifically cited the internet and social media as their only source of this information, which is very telling. I think there's a lot of opportunity for improvement in oncofertility information, the dissemination of this information, and ensuring that we can move the needle in terms of mitigating the psychological distress that many patients experience due to their unfulfilled desire for a child or additional children after cancer treatment. Thanks.
Woo, woo, yay!
Thank you. Was that good? Thank you. Thank you, Dr. Rapp. Do you want me to do it again, or do you think that was okay?
You can do it a couple more times.
Okay.